once again. So welcome to today's webinar, a live webinar. I'm happy to welcome every one of you here. Thank you for attending the webinar. And so today we'll be talking about product packaging in healthcare. And you agree with me that the demand for a better product packaging in healthcare can never be overemphasized. Packaging takes care of a whole lot of needs in the pharmaceutical industry, and packaging can also play a large and helpful part for manufacturers of pharmaceuticals to find new ways to ensure public safety. Depending on the medicine, the particular drug or product is housing, good packaging not only catches the eye, but can also help to distinguish the real product from falsified or substandard products. And according to GS1 standards, a good packaging in healthcare must not only have a barcode, but human readable interpretation, which refers to the characters printed beside the barcode, and it serves as a fallback option in situations where there's no need to manually interpret or process barcoded data. So in this webinar, we'll be learning a whole lot of things: the need for proper packaging in healthcare products, awareness about product packaging in healthcare, and also how to ensure suitable product packaging that can accommodate barcodes for proper scanning. So these and a whole lot of more that we are going to experience today and learn from this webinar. So once again, thank you very much for attending. On this call today, we have the speaker, Neil Piper, who is the Senior Manager, AIGC GS1 Global Office, who is our speaker for today, and also Pharmacist Samson Mata, is the Director and the Superintendent Pharmacist of Philips Pharmaceuticals Nigeria Limited. Can we just say hi to our attendees, please? Mr. Samson.
Hello, everybody.
Okay. Hello.
Good morning. Nice to have every one of you here.
Good morning, everybody.
And on this call with me, I have Brian Idris, who is the GS1 Healthcare Lead for Africa. He's also here on this call. I also have Mrs. Christine Oyewo, who is the Healthcare Lead for GS1 Nigeria. Can we just say hi also to them?
Good morning, everybody.
Okay, all right, without wasting much of our time, we would like to go straight into the webinar proper. So I would like to call on our first speaker for today, who is Mr. Samson Omata, to have the floor. Mr. Samson, you have the floor.
Good morning, everybody.
Good morning.
Good morning.
Yeah, today is a wonderful day, and it's nice to have every one of us here. I'll be talking on packaging in healthcare, product packaging in healthcare. I'll be sharing my slide.
You can share your slides, sir.
Okay. I hope you can see it.
Yes, can see your
Okay,
screen.
good.
Yes,
Thank you.
Okay, product packaging in healthcare. The word packaging, is not strange to all of us, as every day we have to do with one packaging or the other. But on today's subject, we'll be focusing on packaging in healthcare, simply put, pharmaceutical packaging. Packaging is the science and art and technology of enclosing, protecting a product for the purpose of distribution, storage, sales, and use. Now, packaging can be described as a coordinated system in preparing a product for transport, for warehousing, for logistic purpose, for sales purpose, and also for the use by the end user. Packaging, as we know, it contains, it protects, it preserves, it transports, it informs, and it even sells, because you can use your packaging as a product branding. There are different types of packaging. Packaging could come in form of containers, aluminum foils, injectables, vials, bottles, cartons, paper boards, lamy tubes, papers, PVC-based combination. Now, these are the various types of packaging. But I want to delve into the levels of packaging. Like, I'm not sure if most of us are able to see me, but I think I'll just try and be a bit visible. Now, taking a look at this product, there is a content inside this container housing the major product. Now, this bottle is protecting the content of the product, and which is syrup in nature. Now, the level of the packaging that protects the primary object is the primary packaging. Now, this container that is housing the primary container, it's the secondary container. While if a number of this is kept in a carton, one could now describe the carton as the tertiary container. Now, these are basically the levels of packaging. The primary packaging, I said, is the material that first envelopes the product and holds it. That is, those package components and subcomponents that actually come in contact with the product, or those that may have direct effect on the product shelf life. Like in pharmaceutical packaging, it is very worthy of note to know that you cannot just package any product anyhow. Now, pharmaceutical products are treated very jealously, in the sense that there are standard operating procedures which must be followed to ensure the integrity of the product. That's why we have the good manufacturing process, the good distribution process. When it comes to pharmaceuticals, there are a lot of standards that governs the use of medicines globally. And the way we keep or store this product matters a lot. So the shelf life of the product could be affected if the product is not well packed, if the product is not well stored. Like, there are some products that could be kept in an ambient region or ambient condition, like storing a product below 30 degrees. Some are cold chain products, storing them between 2 to 8 degrees. There are some what we call the frozen products, that you have to keep them in between -15 to -25 degrees Celsius. Now, all these are well packed so as to meet the condition of the product. For example, the ampoules, the vials, the pre-filled syringes, the IV containers, blisters are example of primary packaging. Now, why secondary packaging is the outside, or it's outside the primary packaging. It envelopes the primary packaging and use it to group the primary packaging together. That's one of the functions, just like it houses the primary packaging. For example, you have the small containers, the boxes, sometimes the shipping containers, and the rest of them. While the tertiary packaging is used for bulk handling and shipping of product, like the barrels, the cartons, the containers, the protectors, and the rest of them. Now, because there are a lot of things governing the use of medicine globally, and one cannot just take pharmaceuticals as ordinary commodity. Like there are a lot of standards that must be followed globally. Now, every country have its own regulation that governs the storage, the packaging of any product. You cannot just design anything anyhow and put it out for the public to consume. Because when it involves foods, when it involves drugs, care must be taken in following the standards, the regulatory standard that have been stipulated by various regulatory bodies in the country and also globally. Like in Nigeria, NAFDAC actually in its guideline have stipulated some regulation that must be followed in the labeling and the packaging of pharmaceutical products. And we'll be looking at some of the key areas. Like for you to have a packaging material, NAFDAC have said in their guideline of 2019, a packaging product, a packaging material must be prominent. It must be seen, it must be legible, it must be distinct. Now, even the write-up on a pharmaceutical packaging materials must be in English language, basic. It shall be in what English language, although you could add some other language that is relevant to the country, but English language on the packaging is a must. You can't bring a product and you start writing Arabic. How will the reader be able to, assimilate what is being said? Now, in addition, pharmaceutical packaging must be informative. It must be accurate. There's no room for error, because a little error that is done on pharmaceutical packaging will be deleterious. They used to say, if a pharmaceutical firm or a pharmacist does a mistake, a lot of people could die or go down with it, because you've ended up giving the wrong information to the people. You see, this aspect of COVID-19, you see a lot of effort is being taken, is taking the whole world to arrive at a vaccine. They are being very careful, despite that it's a very, it's an emergent situation. They are being careful in ensuring the design or the production of these vaccines, because care must be taken. We don't want to cause more damage than more harm or than good. Now, according to the regulation, it says that pharmaceutical packaging shall not be false. It shall not be misleading. A pharmaceutical packaging must be accurate. You don't just write anything. It must be what is the summary of product characteristics, the SMPC. Now, pharmaceutical packaging must have a special requirement and safety information about the products. Sometimes it's very good to state the let's say not good for pregnant mothers or something like that. Such information, those special information, have to be on the pack. Now, on a pharmaceutical packaging, most of us have seen it. There is a name and the address of the manufacturer. Why? The whole essence of GS1 is for traceability. Now, how do we trace a product if the name of the manufacturer is not being seen? Now, if the GS1 is fully implemented in Nigeria, which I understand in the next few years is almost going to be mandatory for all pharmaceutical firms to enclose the GS1 traceability features on every pack. And this is very, very important of note. That's why it's good we keep our attention on this and ensure that we understand the concept so that we can imbibe and buy into it. So the name of the manufacturer is a must, that the name of the manufacturer have to be on the pack, because we want to trace it. Now, and also the marketing authorization holder details have to be there. That's why you see on the pack, you see manufactured by. When you see manufactured by, is an information relating to the manufacturer. When you see manufactured for, sometimes some pharmaceutical firm may not have the capacity to manufacture. Then they will meet some acceptable or some registered manufacturers to produce for them. Then it is manufactured for, let's say, party B. Then distributed by who? The name of the MAH most times is also imputed for easy marketability. Now, inclusion of NAFDAC registration number. Of course, we all know that NAFDAC reg number, it's a very popular statement in Nigeria. In fact, as a matter of fact, if a product packaging is not having NAFDAC reg number, that product, according to NAFDAC, is regarded as what? Fake. So we should ensure we create the space for this. Now, where a drug is branded and there is also a generic name of the drug on the pack, what does it mean? It means that when you have a branded product and you have the generic name, by generic name means the chemical name on it, the name, the brand name, the generic name must be on the primary pack, it must be on the secondary pack, it also must be on the tertiary pack. So When a drug is branded, the generic and the brand name must be on all the levels of packaging, including the primary, secondary, and tertiary packaging, with the brand name most times on top, then the generic below. It is also important that the strength, that is the milligram or the volume, the strength, and the dosage form of the medicine must be clearly stated on the pack. And sometimes if you have same products of different strengths, it is important that you have a way of differentiating them to avoid confusion or some misleading information. What do I mean? If you have, for example, a product of 5 milligram and another one of 10 milligram, let's say amlodipine 5 milligram, amlodipine 10 milligram, it is important that you differentiate it either by their color code or their color designs to avoid a confusion in the strength so as not to give the wrong information. And also, NAFDAC have also differentiated two classes of products. We have the OTC and the POMs. By OTC, it means the over-the-counter medicines, that is over-the-counter. What do I mean by this? These are classes of products that even a layman can walk into a pharmacy and pick up even without a prescription from the prescriber. But there are also some products we call the POMs, that is prescription-only medicine. These are products that you must have a prescription before you go ahead to get them from the public or from the pharmacist to say. Now, the way you label a POM is different from the way you label a OTC. NAFDAC have made it mandatory that on no occasion should you put the indication or the dosage of a POM on the pack. It is wrong because it is meant to be prescribed. I mean, it's a drug that must be prescribed before you use. If somebody should have an access to it, to abuse it. Now, the essence why they do that is to avoid abuse of such products. But products like paracetamol, which is an OTC medicine, anybody can walk into a pharmacy to pick it up. It's important that while imputing those products packaging or designing, in the process of designing the product packaging, you impute the usage, how it's being used. Sometimes we even add 1 or 2 pictures to that to enable the masses to know how to use this medicine. Now, one unique feature we are talking about today is the GS1. What is this GS1 all about? My colleague is going to delve more into this, but I'll just make a little essence of it. Most of us on our packaging, we must have seen something like a barcode or some form of codes on products. What is the use of these codes? Some people use it maybe perhaps to sell, maybe with a scanner and the rest of them. But the GS1 traceability feature is unique in the sense that it is important because of its unique important for traceability. The GS1 traceability feature is very important because it enables you to track the product at any point in time. So it is very important as manufacturers or importers of pharmaceutical products to ensure you have enough space on your packaging material that could or that should accommodate these traceability features, like all these barcodes and all these form of codes. You should have that space on your packaging to ensure these traceability features. It is very, very important because most of them will enable you to, first of all, identify the product. Some of the serial number will help you to identify whether the product is fake or original. It also enables you to also identify some of the features of the product, the production date, expiry date, and the rest of them. It also, when in the full essence of it, it could be used to track the product anywhere the product is, from one distribution channel to the other in the supply chain. Like, for example, we've talked about the form of packaging, level of packaging, primary packages, secondary packaging, and tertiary packaging. These are some of the examples I've made here, like the NAFDAC reg number on this pack is clearly stated there. Like You can see the brand name of this product, and the active pharmaceutical ingredient is below. The description, the strength of the products are there. And if you look at the product below, you see the warning sign. Those are the special indication for that when pregnancy is detected, temistocin should be discontinued. These are some of the features that must be kept in some of this packaging. And NAFDAC take this thing so seriously. If you bring in any packaging for registration of products, they look at this thing seriously. Your product could be rejected if these guidelines are not being followed. So we should take cognizance of it so as to ensure that these informations meets their guideline. And more in addition, as we are about entering into the GS1 phase, it's good you start, preparing yourself to getting ready to embracing the, the global standards. My colleague is going to delve more on this. Like if you see, right from the primary to the secondary to the tertiary, most of all these features have to be there. There are some product identifier like the global trade item number, known as the GTIN. We also have the serial shipping container code, which is usually helps for the logistics unit identifier. We also have the global location number, GLN. It helps to track the location. We have the global service relation number and the rest of them. So for more information on the labeling guideline of NAFDAC, it's available on their website, and this is the link displaying. So I'll be leaving this, the next section to my colleague to carry on with it. If you have any one or two questions after the whole thing, don't hesitate to get back to us. But very important, let's ensure we follow the NAFDAC guideline while designing our packaging. And very, very soon, the GS1, it will be implemented. And let's have a knowledge of this and let's embrace into it so as to help the easy traceability of our products across the supply chain. Thank you very much.
Thank you, Mr. Sampson, for that wonderful presentation. That was really, really explained. And I believe some of our participants will have questions to ask. So definitely their question will be entertained after the second presentation. So you can always put your question in the chat box so that we can attend to it after the second presentation. Thank you very much. And so the next presenter is going to come up now, Mr. Neil Piper. Hello.
Thank you.
Good morning.
Good morning, everybody. I'll start showing my screen, and then if someone wouldn't mind telling me that they actually see the slides. So hopefully you can now see the introduction slide.
Yes, we can.
We can see your screen, yes.
Wonderful, wonderful, wonderful. Okay, so on a stop go on video now. Thank you for the introduction, Julius, and thank you, Samson, for an excellent presentation. I'm going to follow on now, and I think the key point that Samson made there was entering the GS1 phase. So the slides I'm going to show you now are really about how to start something, okay? So for half an hour, you have my lovely dulcet tones, and I'll be talking about how really you can start using GS1 standards and barcoding on healthcare products, and primarily looking at what we call linear barcodes. Okay, so I'm going to go off video now so we can actually concentrate on the slides. And if you do have any questions, please feel free to put them in the chat. I won't address those questions and answer those questions during the presentation. We'll wait until the end of the presentation and answer the questions. That way we ensure we get through the slides in a timely manner. Okay. So we're going to look at, in the start of this presentation, really the use of what we call linear barcodes on healthcare products. So with regards to linear barcodes, the most common ones used are something called the EAN and UPC barcodes. So if you were to pick up a package, whether it be healthcare or retail, these are the most common products and common barcoding of those products globally, whether it be in Nigeria, Africa, the US, or Europe. So we're going to start off by looking at the EAN barcode, the challenges you have with these wonderful barcodes. And then towards the end of the presentation, we'll talk a little bit about the 2D barcodes that Samson showed in his presentation towards the end. Now, the EAN and UPC barcode that you can see on the screen here are primarily used in retail outlets such as supermarkets. That was their original use, but now they are commonly used in healthcare as well. So whether the product be a retail product or a healthcare product, this is the most common used barcode, okay? Now, a lot of it started out with what we call the retail point of sale. So this barcode was used because it was easy to find, it was a good size, and it was easy to scan. So what is the difference between these two lovely barcodes? Well, the one on the left is a barcode that contains what's called a GTIN12, and a GTIN12 is 12 digits in length, always 12 digits in length, nothing more, nothing less. And the barcode on the right is something called an EN13 barcode, and that contains a GTIN that is 13 digits in length, nothing more, nothing less, okay? So what you might hear in the GS1 standards and people talking is a GTIN or an EAN number. If someone says, you know, I need an EN13 number, or I need an EN13 to go on my product, we need to differentiate and be clear on the terminology being used. An EN13 is a barcode. A GTIN is the number that is contained within that barcode. Now, the most common use, as I say, of these barcodes is in the retail point of sale, but it could be with regards to pharmacy dispensing, it could be over-the-counter dispensing, it could be patient administration, it can be lots of things. Now, when we talked about the GTIN earlier, the GTIN, as I say, is the number encoded in the barcode. So when the barcode is scanned, the information is captured, that number is captured from the barcode, the information is transmitted to a host system, and information about that product, because we're talking about a GTIN here, is taken from the host system. And more often than not, that is a database held somewhere. So that database might hold a lot of information about that product. So the most common thing is the description of that product. So if we're talking about a paracetamol product or a pharmaceutical product, it will pull up the basic information about that product. And you could also drill down and get a lot more information about that product from that unique GTIN. You could get the example of what is contained in that product, the medicinal properties of that product, the dosage, the weight, and lots of other information that might be held in that system. Now we'll talk about the following slides about where you place these barcodes. You know, we've got a number, we've got the GTIN. The GTIN is then encoded in a barcode. What happens and why is barcode placement important? You know, we can't just go and put a barcode anywhere on the package. There has to be consistency to make sure that people can find these barcodes quite easily. So as the slide says here, consistency equals predictability equals efficiency. Consistency of symbol placement is critical to successful scanning, to barcode scanning. With manual barcode scanning, variation of the symbol placement makes it difficult for the scanning operator to predict where the symbol is located, and this reduces efficiency. And also, when we start adding in things like automated scanning, the symbol must be positioned so that it will pass through the field of vision, so that's within the barcode scanning area that it travels through. So whether that be a till, wherever it might be. The last thing we want to see is people trying to find a barcode on a product, and that slows down the dispensation of medicine, the scanning of products through wherever the environment. That will slow things down and can increase problems with patient safety and so on. Now we have some general rules within GS1. Now what we have is a link there to a document that's called the GS1 General Specifications, and it is a document that's published at least once a year, more often than not just once a year, and it's always published in January. So the current version is version 21, and it was published in January of this year. Within that document, it details everything about what barcodes to use, the specifications for those barcodes, what data can be used. So when Samson talked about earlier, saying about traceability of products and putting information onto products about that product, for example, the GTIN of the product, the expiry date, the batch number, the seal number, all of that information and how to encode that information is contained within these guidelines. So for example, the batch number and the seal number, whilst we say they are numbers, they don't have to be numbers. They could be alphanumeric. And the character set that can be used is defined within these guidelines. So one of the things that we have as what we call a general rule within these guidelines is that we only apply one GTIN per physical product. If we have multiple GTINs on the same physical product, which one is the correct one to scan? So that is a general principle. And also, more often than not, in general use, we'll only have one barcode on the product. Now, it's becoming more and more common to have multiple barcodes on products. So again, referring back to the example that Samson showed at the end, he showed what's called a two-dimensional barcode, the one with the batch, seal number, expiry date, and GTIN in it. That is a 2D barcode. So it's quite common to have what we call an EN linear barcode and a two-dimensional barcode on the product as well. They both serve different purposes and they can both contain different information. Last but not least is to say that sometimes multiple barcodes are allowed. So on certain products where it might be quite large, we actually do encourage more than one barcode to be placed on that product because it makes it easier to find and easier to scan, easier to manage. So when we start looking at products that might be large and bulky, not very common in pharmaceutical products, I admit, it is very difficult to move that product. So you want to be able to scan it easily. So if barcodes on the adjacent sides, that way the user can ensure they can scan that barcode of that product. Another consideration for the barcode is, where is the barcode being scanned? What is the scanning environment? So we have guidelines on what sizes of barcodes can be used, what barcodes can be used themselves, so what barcode symbology. So examples here show a general pharmacy on the left-hand side and in a warehouse environment. So it depends on the product packaging. So whilst we were talking earlier on the previous presentation about primary, secondary, and tertiary packaging, the type of packaging and where the packaging is scanned will determine what type of barcode can be used. And we have, again, guidelines that will be talked about within the GS1 general specifications about what can be used to barcode those products. Whilst we're showing some what I call generally retail products here, it's important to note that when we start looking at barcodes, the packaging of the product will differ. So examples are, we might have, boxes that might contain pharmaceutical packaging, the cardboard packaging, the secondary packaging. We might have tubes, we might have vials, we might have bottles, we might have jars. There's lots of different types and shapes of products that need to be barcoded. So the general rule for barcoding, linear barcodes and also these two-dimensional product barcodes, is that the barcode, you want to try and put it on as flat a surface as possible. So sometimes what happens then is, looking at the orientation of the product might determine where the barcode goes, and it might determine what type of barcode printing is used to print that barcode. So what we have here is we have two different scenarios showing the placement of the barcode on different products. Now, the two products shown here are generally rounded surfaces, and the barcodes have been placed to ensure that A, they can be scanned, and B, they fit on the product. So on the left, we have something called ladder orientation. And as you can guess, it's called ladder orientation because it looks like a ladder. It looks like you can climb up the barcode. And the picture on the right shows the barcode printed in what's called picket fence. And again, the name for that has been chosen because it looks like a fence and it goes around the product. And on both these products, it's showing a barcode being printed on the flattest available side. So the picture on the left, if we tried printing that on what we call picket fence, the shape of the product, the curvature of the product might mean that the barcode cannot be scanned. It would not physically be possible to scan it. So it's impractical and foolish to do that because there's no point in putting a barcode on a product that you know will not scan. The following slides, we're now going to talk about a little bit about correct placement, because again, when a person picks a product up, they roughly want to know where that barcode will be without having to search around the product for it, because that barcode might be quite small and the product might be quite big. So we're talking about point of sale here, but again, this still applies to retail products as well. You know, generally, more often than not, the product we pick up will have the primary trading, the advertising of the product on the front of the product. So that might be the brand name, the brand logo. It might be information about that product. So if I was to walk into a pharmacy store and I wanted to pick up some general paracetamol products, there might be several of those displayed for sale within that pharmacy. So more often than not, the product that is shown to me on the shelving, it is the front of that product. And that will, as I say, detail the type of product it is, the brand name, and other information that would basically be the first part of the information I would require about that product. So if I'm looking for paracetamol, I want to know I'm looking at paracetamol rather than something else. So we have guidelines on where these barcodes go, what happens to them, and so on. Now, the first thing to consider when we start looking at barcodes is what we call the edge rule. Now, whenever possible, the barcode must not be closer than 8 millimeters or farther than 100 millimeters from the nearest edge of the package or the container or whatever you are barcoding. Now, previously we'd allowed 5 millimeters, but due to practical experience, it showed that when users picked the product up, that meant their fingers or their thumbs were going over the barcode, and constant picking up of the product then could damage the barcode and mean it couldn't then be scanned because the printing and the material might be, rubbed away, damaged, marking might be left on it, and so on. So that was basically a rule for that placement rule. Lastly, also packaging edges can be damaged. I mean, whilst we're talking about cardboard packaging here, if a box is dropped on the floor, for example, generally it falls on the side. And if that happens to be the side where the barcode is placed, that means the barcode might then be damaged, which means it won't scan. Now we have other rules regarding, as I said, about round surfaces and different surfaces. So here's some examples of what we call bottles and jars. So these are quite common within a pharmacy environment. So we'll generally say, for example, if you look at the Cuticura product on the right-hand side, a very bad place to put a barcode for that example would be on the neck of the bottle. So if I placed a barcode on the neck of the bottle, it would require additional handling because A, it's a very round surface. Someone might pick it up by the neck, and also it isn't a large surface area. So there will be challenges to place a barcode on that and ensure that the barcode that is placed on that neck, for example, it will be very small. And we'll come on to some examples later on why reducing barcode size isn't a good area. And on the left-hand side, you'll see an example of what I call a tub. So a tub of cream, so Sudocrem in this example. So we're showing the Sudocrem there when it's stood up, upright. That is in ladder orientation because, again, it's the flattest part of the surface. And the same goes for the Cuticura product on the right-hand side. Ladder orientation has been chosen because it's quite a flat surface, and also the space on the label that's been applied to the product allows it for the placement. I've shown some examples of boxes previously with the paracetamol. Here's another example of a pharmaceutical product that you might find in a typical pharmacy. So this is basically cuboid or cylindrical card or plastic cartons. This is the type of thing that could be found. There are no unique considerations that apply to this packaging type. Generally, we try and say that the barcode is placed on the rear of this product. So that would be the middle picture to the right-hand side, but that isn't always possible. So what we will then find is the barcode will then be placed on the side of the packaging. So you'll see that on the right-hand side of the packaging on the picture on that screen. And in this example, the barcode has been placed, the orientation has been selected based on the space available for that barcode. So again, we have the considerations of the space of the barcode to the side of the packaging to make sure it doesn't encroach on that guideline we talked about earlier. So the product was dropped, the barcode would still scan. And here's just another example of the same thing for boxes. Here we have an example of some Canesten cream. The front of the packaging shows the name of the product, the size, the weight of the product, maybe even the active ingredient in the product. On the natural size of it, we have the manufacturer and the barcode. On the back of this product, in this instance, it actually is the same. Both the front and the back contain the brand name and other information that's just duplicated. Now we come to multi-packs. So multi-packs are single items that are packaged together as one unit for trade purposes or for transportation purposes. Okay, so these multi-packs might contain bottles, cans, jars, tubs, whatever they might be. So again, the individual products, the single items that go into these multi-packs might be barcoded, but there's also barcode considerations for the multi-packs themselves. And there might be different barcodes used for those products. So again, on this example, we're showing the preferred placement on the right-hand side of the back of the product near the edge, but again, respecting these edge restrictions and also something called the quiet zone. And we'll come on to something called the quiet zone in a minute on later slides, because the quiet zone is talking about how we create a barcode, what space is needed around that barcode. Now, there's one special note about multi-packs is that we try and avoid placing the barcode symbol on the top or the bottom of the container. Another consideration that I hadn't thought about putting in these slides, but just suddenly come to my mind, is that another consideration is when we start barcoding multi-packs, and again, we can do further conversations on this on another webinar, because we'll need to go into more depth on the advances in barcoding and what other symbols are used, is that when we barcode a multi-pack, we need to ensure that the barcodes on the single items aren't visible, because we need to be clear about which barcode and which GTM we actually need to scan. Tubes is another one. Now, this is a cork tube as an example, but it could be tubes of ointment, cream, things like toothpaste is the most common thing I can think of, the types of tubes. And typically tubes are cylindrical shaped items or containers that are either sealed at both ends or one end, okay? Now, for the preferred placement of these is on the lower right quadrant of the back, near the edge, again, respecting this lovely term called a quiet zone for the barcode. So you'll see there some preferred placement. So that's on the natural reverse of the product. And again, an undesirable location really is at the front. But if it is the only location that's possible, then that has to be accepted. Now, we've talked a little bit about placement, and I've covered what I call typical products you might find in a healthcare environment. You're always going to get different types of packaging. Product packaging being the material that is used for packaging that might cause challenges to the placement of the barcodes, the barcode printing itself. But we're going to talk about a little bit further on now is really some of the barcodes that are applied, and these are linear barcodes, some of the considerations that need to be considered before the barcode is printed on that packaging. Now, when we generally talk about linear products on packaging, generally those packages, those barcodes are generally barcoded as part of the artwork, okay? So we're not talking about on-demand printing. So when Samson showed the example of the 2D barcode, and we'll show this later, generally those barcodes that are used for traceability are printed on demand at the time of manufacture because they have a lot of what we call production information encoded in the barcode. The barcodes we're talking about here are generally barcodes that identify the product itself, not the instance of the product, not the batch of product that might be created or the specificness of that product. So these barcodes generally are printed in advance of the product being put into that product. So one of the first things that people need to consider when they start looking at barcoding using linear barcodes is things like what we call truncation. So the bottom barcode that says what we call a normal symbol, that is a UPC-A barcode, and that's what's called at full height. So within the GS1 standards, we have guidance on what heights barcode should be, what magnification factor they should be. And depending on where that barcode is used and where it is placed, the different size of barcodes will be appropriate. So we always try and encourage people to use barcodes in their full size. That isn't always possible. And we'll show some slides about some of the challenges that manufacturers have a little later. So truncation is the reduction of the height of a barcode relative to its width. So you'll see we've got the two barcodes there. They both contain the same GTIN. They are both the same barcode. One has just been shortened and the height reduced. Now, that might cause problems for scanning, and we'll show a little bit about that on the next slide. So what happens when we truncate a barcode? So when we reduce the height of the barcode, it basically limits the scanning effectiveness. Now, more often than not, the most common scanning technology still around today is what we call laser-based scanning. So laser-based scanning is, if you scan it, you generally see lines. You might see multiple lines of the barcode scanner onto the product. Now, the trend now is to what we call camera-based technology. So if you all have, Samsung Galaxy phones, iPhones now, those all have cameras, and those use camera-based technology to scan barcodes. So take a picture of barcode and scan it. But more often than not, the most common form of technology still around is probably laser in a lot of environments, although healthcare now is really driving towards camera-based technology only. So as you'll see there, if we tried scanning the barcode with a typical laser scanner, not all the laser beams will pick up the full width of the barcode. So it won't scan, and sometimes it might actually misscan. It would get the wrong information. Okay, so that's why truncation is really only to be used in extreme circumstances. And the next slide will show you an example of that. So as you can see on this product, okay, this might be a pen, but this could apply to a lot of pharmaceutical products. It could be a syringe, for example. And if we're trying to apply a linear barcode to that type of product, then there are certain considerations and things that have to be done here because there's no alternative. So the first thing is that the barcode can only go in one orientation. So the orientation for this barcode actually is ladder orientation because the barcode would be stood on its end, the product would be stood on its end. And also it can't be wrapped around the product because you wouldn't be able to scan it. The second thing is that the barcode can't be printed at full height. So it requires truncation because, again, you can only see the product has a certain width. The next thing to consider is colors. Now, colors are very important because the packaging used can impact the reliability of the scanning of the barcode. Now, typically barcode scanners, the laser scanners, they read barcodes through what's called a red light source, laser light, okay? So generally what we try and say is we want the bar of the barcode, those lines that you see in a barcode, to be as dark as possible and the background to be as light as possible. So generally we say things like the bars need to be cold colors and the background needs to be warm colors, okay? And we're going to show some examples of different colors on the next slide. So as I said on the previous slide, you want to be as dark as possible for the foreground, for the barcode itself, and as light as possible for the background. So the perfect combination is the black barcode and the white background. But there are plenty of other colors that can be used. So for example, a red background is perfectly fine because for a laser, it doesn't see red light, so it treats it as if it's white. So it's perfectly fine to scan. Yellow is another color, okay? Now, the barcode colors, we want to be as dark as possible. And the other thing is we don't want to see what we call negative images. So the picture on the left, one where it's a black barcode on a white background, we wouldn't want to see a negative image of that used. It won't work, not for linear barcodes anyway. So these are the most suitable and reliable color combination is black bars on a white background. So here we have some bad examples. So these are ones to not use. So what we have here is we have some warm colors on a warm background. So we have yellow on white. won't scan. Red on white. To a barcode scanner, red on white is pretty much just white. It'll only see white. It doesn't see the barcode itself. So these are some bad examples. And the ones with the bluish color and the greenish color, those are reversed out images. So again, they won't scan and they're not permitted. Another examples of common problems to be avoided is never use the material contained within the product as the background. So for example, if you were creating a product that had liquid in it, or it was a very transparent material used in the packaging, that might cause problems because the material or the product contained within the packaging, it might be reduced, it might be dispensed, and actually the volume of the product might be reduced. So you then are having a different background for the product. And also the colors might change. So depending on the product you use, the color might change depending on what happens to that product. So although this barcode looks fine to the naked eye, it won't scan. Because the product behind it is of different colors and you've tried using white ink as the negative version of the product. More often than not, what people should apply here is if it's a glass see-through transparent packaging material, you apply a label to it. And the label actually provides the background and the foreground for the barcode. Here's some other examples of typical packaging material used that you have to apply a barcode to. So there's some bad example in the middle one. So the Crespo here is okay, it's a food type, but I'm trying to get the message across that the packaging is important. So the one on the left, that isn't too bad because it's printing a black barcode on a white background. The problem with that is though the packaging, it's quite scrunchy, okay? And the barcode is then basically distorted and means it won't scan very easily. The second image from the left, again, is using the product behind it as the background. Again, not great because it might be a dark product. And again, the product could be scrunched together. Examples in the middle and to the far right, very good examples. So we've got a tub and a tube showing a barcode being placed sensibly, okay, with an appropriate color and appropriate barcode height. Now, we talked about quiet zones earlier. Now, within our GS1 standards, we have guidelines on what space needs to be around all barcodes. Now, with the linear barcodes, it's very important because the scanner needs to see the start of the barcode and the end of the barcode to be able to decode the information from the barcode and then successfully scan it and pull up the information about the thing you're identifying. So as you'll see here, we have a barcode, we have the GTIN encoded. So the number 5 on the left is sort of acting as like a quiet zone indicator. It's making sure that no other information is provided to the left of that product that encroaches on the actual bars within the barcode. However, on the right-hand side of that barcode, you can see the number 9, and then there's 2 bars to the right of it, and then a big thick line coming down. The big thick line is just a box that's been put around the barcode. And unfortunately, that line encroaches on the barcode. It's not within what's called the specified quiet zone around the barcode. So that means this barcode will not scan. So no matter how hard you try, the barcode just will not scan, which defeats the purpose of putting a barcode on a product. So for each barcode symbology we have within the GS1 standards, we have definitions of the size of the area for the quiet zone to the left and to the right of the barcode. We don't have quiet zones above and below a barcode because that is just the height. The barcode is read from left to right, okay? The data is only encoded along the x-axis on these examples. So here we have the measurements. So when we create barcodes based on a measurement called an X dimension. And again, I'm not going to go into too much detail on that because that's getting a lot more into technical details of the barcode symbology itself. But here we're showing examples. The most common use is this EN13. We need 11 times the X dimension on the left-hand side of the barcode and 7 times the X dimension on the right-hand side of the barcode as space that is not encroached on so the barcode can be scanned. And again, all of this information is contained within our standards. Another thing to consider when you start looking at barcodes, and that applies to what we call the traceability barcodes that Samson talked about earlier, or these linear barcodes that I've been talking about, is something called barcode verification. What barcode verification does is it makes sure that the barcode you apply to your final product meets the standards, meets the requirements, and can be scanned. And it'll give you a report, and that report will detail how good that barcode has been printed on that product. Sometimes it'd be very difficult to get what we call a perfect report because the material used, the packaging used, the ink used, the printing process used, they may all vary. And sometimes it's very difficult to get a perfect score, but it will give you guidance on what you're doing right and what you're doing wrong and corrections that might be needed. So this is just a summary slide talking about barcode verification. So if you want to know a little bit more about it, please do. The one thing to note, though, that the barcode verification is carried out on the final product, on the packaged product in its final state. So it's worthwhile when you start creating packaging to do that during the stages, because the verification and validation will check that you're actually on the right route. And I think in the future, it might be an idea to talk about this in more depth, but that can be talked about on another call. So Samson talked about this wonderful other barcode that can be used for traceability. So I'm going to very high level talk about these, because you might see or might consider putting more than one barcode onto your product packaging. So on the left, we see this lovely EM barcode that I've been talking about. It's been pre-printed. It's on the artwork. The second barcode on the right is a GS1 data matrix, and these look a bit like chessboards. And these barcodes are generally now used for regulated products and appear based on regulations. And as you'll see there, we've got 4 different data elements encoded in the barcode. We have the product code, that's the PC, it's there, it's the GTIN. We have the serial number, we have the lot number, and we have an expiry date. Now, the GTIN of the barcode on the right is the same as the GTIN on the barcode on the left. Those two are exactly the same, but they will serve different purposes. So, for example, if you walk into a retail pharmacy, you might need to scan a barcode to sell it. So the barcode on the left is needed. But if you're in a clinical environment and you need to make sure that you track and trace the actual batch of product given to a patient, then the barcode on the right would contain that information. So these are some examples of what we're seeing is happening now within in healthcare. It's becoming very common to start using the barcode on the right, the GS1 2D data matrix. And here's some other examples. So again, we have the linear barcode on the packaging that could be used for either administration to the patient or for dispensation at the pharmacy, or even for sale within a retail pharmacy, and a different barcode encoding additional information on the right-hand side. And last but not least, this is another one. So we've shown 3 products that all show this additional barcode encoding different information. So what you will see here is we have different people call things different names. So the PC here, it might just say GTIN and give you the number. And these are called data titles. So they basically are there. So if the barcode fails, a human reading it can actually see the information and check it. So for example, if I couldn't scan this 2D data matrix barcode when I was trying to administer it to a patient, I might check the human readable information, the 05-2005, to make sure that the date is still applicable and can still be used on that patient. So let's say, for example, the date on here was 05-2020, then I'd say, oh, I can't give that drug to that patient because it has expired. But we can talk about this and other information on a later webinar. Now, finally, I'm going to talk about what we call the good, the bad, and the ugly. So I've tried to use the analogy of the Clint Eastwood film, that there's always good ways of doing things, there's bad ways of doing things, and there's attempts at doing things that turn out to be quite ugly. So we'll show you to start with the good. So this is a typical box of penicillin. This is the front of the box. Okay, it's been a bit crushed because it's been sat on my shelf for a while. I dropped things on it, but that shows an example of damage that might happen to packaging in a general environment. At the back, we have more information about that product with the linear barcode. And again, you can see there, the quiet zones are clearly spaced. They have plenty of space around the barcode, and this will scan quite easily, quite nicely. And then lastly, we have the secondary barcode that could give us other information about that product. Now we'll show some truly horrible efforts at barcoding. So it's always worth considering when we create a barcode, the final state of that product, what will be used to package it. So an example on the left here is that we've got some aerosols, some cans that have been boxed up, and those boxes in there in the final state, a label's been applied, but the label has been sort of vacuum sealed against the material of the product itself. Now the barcode there probably won't scan, so it's not great and defeats the purpose of having a barcode really. Barcode on the right, the color. The orientation is good, the placement is good, the color of the barcode and the background is bad. Products on the left, again, we've got shrink wrap all around it. We've got multiple barcodes on the packaging. Which is the correct barcode to scan? The user might not know. Middle one, again, it's glass, it's a round surface, it's a red background. And again, we're using the bars of the product behind it. It'll have no hope of scanning. Product to the right, the last one I'm going to show you. Again, the barcode is being placed correctly. It's in ladder orientation because this product actually stands on its end. But there's been no consideration for the quiet zone to the right of it. So again, the barcode would probably not scan in this instance. So that's been some slides on some general overview. You've gone 5 minutes over, so I do apologize for that. So general overview of barcoding, predominantly linear barcodes on product packaging. I think we can do a further one on 2D barcoding because that is printing barcodes at the time of manufacture, and that requires a lot more technical skills, and based on the speed of your production line depends on what information and how you can print. There's a lot of other considerations for 2D printing on different products. So that's going to be finished. I think we can now say that I've seen some questions in chat and we can hopefully answer your questions. So thank you. And I'll stop sharing because there might be other slides that Julius might want to share.
Thank you very much, Mr. Neil, for that wonderful presentation and also doing justice to that presentation. Thank you very much. I don't know if any one of us has any question. Is there any question? I want to check the chat box to see if there are questions. Okay.
Thank you, Nuran, for popping the links in there.
Okay. You can also unmute if you want to ask any question also.
And don't worry about it. If you haven't got questions now, it's perfectly fine to ask them to Julius. And
Okay.
either answer the questions later, or we can answer the questions offline if people need time to think about the information that's being provided to them. But again, if you want questions now, perfectly fine. But don't worry about having to ask questions now. We can answer them later for you.
Okay, thank you. That's definitely fine. Thank you. All right. So on this call today, we also have an important personality, the Deputy Director of NAFDAC Registration and Regulation, Pharmacist Chukwuma Olibu. Please, can you just say hi to our attendees? Pharmacist Chukwuma. Are you still there? Pharmacist Chukwuma, please, can you just say hello to our attendees, please? I think maybe he's busy. All right. I'll be posting a link in the chat box. Okay, can you all hear me now? I'll be posting a link in the chat box, and The link is just for us to hear our views about the webinar. So I'll be posting it there. Please just kindly fill the form. It won't take you more than a minute to fill. Thank you.
So while we're filling the form, I would like to thank all of you very much for attending this webinar on product packaging. My name is Christine Oyewo. I lead healthcare in GS1 Nigeria. Both Julius and myself, we're going to leave our contact details in the chat box. If you want to get in touch with us, if you want to obtain any information about what GS1 Nigeria is doing and what we're doing towards actually implementing traceability in Nigeria, you are free to reach out to us. In the chat box, we have put information pertaining the activities of NAFDAC in the area of track and trace and traceability, and what they have been doing so far in the Nigerian healthcare space, including a report on the national traceability pilot. We are also, Nuran has supported us by putting information in the chat box on general GS1 general specifications with regards to our standards, our barcodes, specifically barcodes in healthcare, and how these our standards actually operate within the Nigerian space and how to actually implement them. We are very it's very important for us to realize that for any of us that are actually working in production, in local production, and who are interested in and who wish to implement 2D data matrix barcoding on our product packaging, that this information, that this process might require some amendments of your packaging plant to allow for the placement of 2D data matrix barcodes at the point of production, and also the availability of a scanner to scan and commission these barcodes, which shows us that this product has been commissioned at this location. So to obtain more information about this, you can reach out to either Julius or myself. I think we have two chats in the chat box. So you can please fill the assessment form. Thank you very much.
Thank you, Mrs. Christine. I'll be sharing our contacts in the chat box for us to contact. If you want to contact GS1 Nigeria, you can always reach us through those contacts. Thank you. So with this, we've come to the end of the webinar. The webinar will be sent to the recording webinar will be sent to your emails, and the material also will be sent to your emails also. So for the link I shared with you earlier, please kindly fill the form. We just want to assess it for us to know your expectation about this webinar and other topics you feel you can also come up with to discuss further within the pharmaceutical industry. Thank you very much. And also we'll be sharing a particular link also for you to learn more about GS1 and other events that are coming up during the year. We will share it in the chat box also. Thank you. So I'll be sharing the link for you to join the Healthcare Online Summit that is coming up in November. We encourage you to join. It's a global healthcare community to discuss the role of global standard. And this event is coming up in November. So the link has been shared in the chat box for everyone to see. All right, thank you everyone. Thank you for attending the webinar. We'll get back to you with the recordings and also the material that was presented today. Thank you very much. Have a lovely day ahead. Bye.
Thanks, everyone. Take
All right.
care.
Welcome. Bye. Mr. Sampson,
Thank you,
thank you very
everyone.
much. Yeah.
Thanks.
Mr. Sampson, thank you very much. Can you hear me?
Yeah, thank you, Mr. Julius. Thanks for
Yeah.
arranging this.
It's good to have you around, sir. Thank you for your time.
You're welcome.
Yeah, hello, Mr. Julius.
Yes, I can hear you.
For those of us that joined it, are we going to get recorded of the?
Yes, you will
Okay.
get the recordings
Thank you
today.
very much. Thank you.
You're
Thank you.
welcome. You're welcome.